And moderators from session 3, I'd like to welcome Dr. Lucy Fang, the Deputy Director of the Division of DQMM, to provide the closing remarks.
Can you hear me?
Yes, we can.
Okay. On behalf of the Planning Committee, I want to thank you all for attending today's workshop. The purpose of this workshop is to engage the generic drug industry and other involved stakeholders regarding how mechanical modeling and simulation can support their product development and regulatory submissions. Share the current state of the mechanical modeling for B assessment through case studies, establish a consensus on best practice for using PBPK and CFD modeling for B assessment to help drive further investment by generic drug industry into mechanical modeling simulation. We want to thank CRCG, the Center for Research on Complex Generics, for the support on organizing this workshop. The center helps the FDA to enhance research collaborations with generic industry to achieve the FDA's mission of increasing access to safe and effective generic products. I'm happy to share with you that more than 1,400 people registered this workshop, and we hope to see more regulatory submissions using mechanical modeling and simulation to address questions related to the alternative B approaches. We want to thank Dr. Jacqueline Corrigan-Curry, the Principal Deputy Director of CSER, for delivering the opening remarks. Dr. Corrigan-Curry talked about the center effort on promoting the regulatory use of modeling in the MIDD pilot program. She complemented the GDUFA regulatory science program and supported research to develop innovative modeling simulation tools for generic drugs. Our keynote speaker, Dr. Xiuming Huang, the Deputy Director of the Office of Clinical Pharmacology, shared her insights on the use of PBPK in new drug development and regulatory review from clinical pharmacology perspective. We started our workshop with the first session on the use of modeling simulation to support development and regulatory assessment of generic orally inhaled drug products, OIDPS. We hope you appreciate the complexity of the generic OIDPS. Our excellent speakers and panel discussion covered the safety modeling as well as semi-empirical regional deposition model coupled with PBPK model to better understand the relationship between in vitro metrics and in vivo components and as potential components of alternative approaches for OIDPS. This is an evolving area, and we hope to see more advancement. The next session focuses on the dermal PBPK modeling. The FDA has driven advancement in modeling platforms for topical transdermal products. It is suggested that the dermal PBPK model should incorporate the skin's physiology and formulation attributes, also be validated against the in vitro in vivo performance data such as IVPG. A great example has been presented on how dermal PBPK modeling simulation in conjunction with parameter sensitivity analysis can be used to systemically evaluate the impact of drug product quality attributes on the local bioavailability of topical dermatological products. We also discussed a case study of using dermal PBPK modeling simulation approaches towards developing an in vitro in vivo extrapolation that allows for assessing the impact of formulation difference on local bioavailability within the context of a virtual bioequivalence assessment. We also discussed the development, verification, and validation of the dermal PBPK model of diclofenac topical gel, which supported the B assessment in the regulatory submission. We especially discussed the performance assessment of the modeling platform as well as the dermal PBPK models for the reference and test products. The last session of day 1 covered the mechanical modeling for other locally acting areas, which have not been covered in session 1 and session 2, such as ophthalmic, nasal, implants, and injectables. We shared FDA internal research, external research grants, and contracts to advance the mechanical modeling approaches to support development and regulatory assessment of complex generics in these areas. We also discussed some case examples from industry, focusing on current scientific considerations In modeling topical, ophthalmic, and intramuscular injection products, in the panel discussion, you heard how the PBPK can help us establish the in vivo relevance of the in vitro release test in this area. I hope you enjoyed day one of our workshop. With that, our day one workshop is concluded. Thank you.
Thank you, Dr. Fang. A couple of housekeeping things before we end today's session. For tomorrow's event, you would be joining with a separate link. So please go back and look at your registration information. You should have received an email and a separate link for day 2. The event starts at 8:30 a.m. Eastern Time tomorrow as well. And we look forward to seeing you all tomorrow. I'd like to thank all of the speakers, moderators, and panelists for their valuable time and wonderful presentations and discussions that they offered today. I hope all the attendees had a great time and found this workshop to be useful. We look forward to seeing you tomorrow. Thank you.